welcome to my laparoscopy and hysteroscopy vlog. Not a video I thought I'd make, but here we are. I will tell you and take you on the journey of the surgery and then talk about it and the diagnosis that's come from it. Trigger warnings, there will be discussions about operations and diagnosis. So if you are not wanting to engage with that content, then stop watching. But if you, like me, want to see the reality of going through a diagnostic laparoscopy for endometriosis and hysteroscopy, then stay on. This is a vlog about the diagnosis of endometriosis, so keep watching. Diary from day one, recovering. I'm in bed now. It was a lot more challenging than I thought it might be in some respects. Like, I really can't do very much for myself. Mum had to brush my hair, I couldn't flush the toilet, but I also made it through. Having people around really helps. And take the laxatives and eat fibrous food and drink loads of coconut water and watermelon would be my recovery tips for day number one. I will come back. I'm just through my third day at home and I'm standing. Is it my third day at home? Yes, I'm losing track of the days. It's Saturday today. And I've had a lot of big wins today. I definitely think having the bandages taken off yesterday and being able to see like the incision sites has made me feel like safer and less stressed. And I think because of that I've been able to relax more, and I actually slept last night. So I think all of that together has been positive. I managed to get up this morning and go for a walk with Tay, which was a big step. Had to stop a lot and maybe like walk very slowly on a walk that normally I do quite quickly. But we got there, I looked at the sea, which is very healing, and then we got an Uber home, which was actually tough. I think cars, when you've got stitches, are really intense. So I'd like to avoid cars as much as I can, to be honest. But I'd also like to see the beach again tomorrow. So we'll see which wins out. Pain is more manageable today. I've taken less pain medication. I've only taken paracetamol this whole time because I don't respond very well to painkillers. I vomit from codeine and I get rashes and have bad asthma from ibuprofen. So I just basically have to raw dog these things quite intensely, other than paracetamol. Sorry if you can hear that. That is a motorcycle going past my house. But yeah, and I'm now standing up because my back has had enough of sitting down. That has been my like little throne that people have been bringing me things and has to refluff for me like every 2 hours. And I've had friends and family, like I had my mum here for the first couple of days, and then Tay's now been here for 2 days. Ali came for the day before yesterday, and Eve's now here for the day and tonight as well. And that's been really nice, just to be surrounded by people that know me really well, that I feel comfortable being able to like ask them to flush the toilet for me and like help me get up and wash my hair and help me in and out of the shower and all the things that I have needed help with, take on and off my shoes or on and off my compression socks. So yeah, I think fill up my water. So all those things have been really important to have people that I feel really comfy and like intimate with already. So yeah, I've been really grateful for that. But yeah, I definitely think today I've turned a corner and I'm feeling loads better than I was yesterday, and the moments where I felt shaky today and like intense have been a lot smaller. I haven't had any gas pains today, or if I have, they've been really subtle, so that's a big win. So yeah, I think it's turning a corner now, and we'll keep going. I'll check in with you guys tomorrow and let you know where I'm at. But I'm standing and I'm no longer just in a t-shirt. I'm in an actual outfit. I bought a few new clothes for this period before I had it, because I read loads. I asked for loads of advice and people said get loose clothes, and I don't actually have many loose clothes, I've realised, because you don't want anything on your belly at all. And people say loose trousers, but you don't. Where one of my incisions is like the top of my like pubic bone, so right now my underwear are like folded down below that, so like you can't really wear trousers because the second you sit down they push up onto that and then you're in pain. So, and then the next one's on my like just above my hip, so then I'd be in pain there, and then the next one's on my belly button, so then I'd be in pain there, and then the next point would be what your like upper waist, where your ribs are, but that's where my gas pain is, so then it would compress there. So I just can't have anything on. I'm actually so glad I've not gone through this in winter from that perspective, because I don't know how I'd rug up. I think I'd just have to be in a blanket and like a thick dressing gown probably. So yeah, in a way I'm really glad, and I'm even more glad that the temperature's dropped and that we're at that like temperate level, because yeah, it being really hot on the first day, it was really difficult, and I was really worried that it was going to continue to be hot, and you wouldn't want to have these stitches and them now be open to the world when you're really sweaty either, I don't think. So I'm very, very grateful for this exact tiny little temperature window.
Now I'm just like,
Well,
we go to
special effects. People who've worked in special effects
So what,
since,
like,
who've like seen that film and really
We're here at the, what's it called? At the hospital.
Relationship where trust is not solid.
Hi guys, so you'll have seen the full video. I think I told you what happened, or maybe I just told you about the recovery. It's definitely not a video I ever wanted to have to make. I've been slowly coming to terms with the reality it's something that I would wake up with. It's been like 2 weeks now. It was 2 weeks since I had surgery yesterday. And yeah, I woke up to the diagnosis of endometriosis from the surgery. They found it on my outside of my womb, my right fallopian tube, both ovaries, and my bladder. They did a technique called ablation, which is essentially burning the endometriosis lesions off of my outside of my womb, both ovaries, and my fallopian tube. The bladder's a really sensitive organ though, so they couldn't do that on my bladder. So they left the endometriosis lesions that were on my bladder, which terrifies me. And we're in that watch and wait as to whether I need more surgery on that at a later point, because that would require a technique called excision, which is where you cut it off. And I didn't know any of this before I had the surgery, but a gynecologist can perform a diagnostic laparoscopy, which is what I had, and mine was diagnose and treat, and that's performed by a gynecologist, and then they are qualified to perform the technique of ablation, so the burning off. But if you require excision, it requires an endometriosis specialist surgeon, so you'd need surgery at a later date. So I think that's like good for people to know if they have suspected endometriosis, and if it's suspected or diagnosed on certain organs, like making sure that like you're with the right qualified team so that you don't need to have multiple surgeries, because I will say it's been quite an intense recovery. They called it superficial endometriosis. The surgeon called it that when I woke up, because the lesions looked like they were on the surface of my organs, and there was no adhesions or scar tissue connecting them all. I think there was some evidence of scarring, but like I don't think scar tissue had formed. So that changes the staging. So superficial is kind of like considered stage 1, but they were quite hesitant to use that language with me, and I now know why. And it's because I did more research later, because again, what they tell you and the research is so far apart from each other. And even the clinical care from what the research says versus what you receive is so different. If you have endometriosis that's spread beyond your like reproductive pelvic organs, it is automatically considered, I think, stage 4, even if you don't have the adhesions. And if you know more about endometriosis than me, maybe that's wrong, but on the research that I've done since it, that appears to be the case. So yeah, it's kind of a weird one to wake up to, because I kind of felt like it was very downplayed to me when I woke up, which made me feel maybe a false sense of calm in the immediacy, which was also maybe good. You know, waking up's a really intense experience. I woke up obviously in the recovery area, in loads of pain, on loads of drugs, still bleeding from my wounds, and it's quite intense. Yeah, I don't want to scare people. You'll be fine. If you're watching this and you're going to go through this journey, that you will be fine. It is one of those things I was so scared to have to go through, but I've got through it. Like obviously I'm still in recovery. You're in recovery for 6 weeks, but the first 3 days or 4 days, maybe 5, really tough. First 3 days I was in loads and loads and loads of pain, and maybe really a week in quite a bit of pain. I react really badly to codeine, and I'd reacted really badly to the pain medication they'd given me after the surgery. I think they gave me morphine and fentanyl, and it made my blood pressure really, really low. So I had to stay in the ward all day, and then I probably realistically should have kept staying, because we tried to go home and I had to be like put in a wheelchair to go out of the hospital, and then had the most horrible Uber ride home in like a car with no suspension and a man with no empathy, and he was just like jolting everywhere, pulling on the stitches and the pain, and just sitting up because my blood pressure just hadn't risen again. I vomited in the car in a pad bag, which felt very poetic, ironic. Thank God I had the pad bag. So yeah, that wasn't fun. And then because of all the movement when I got home, all of the bandages that were meant to be on for 3 days had like filled with blood, so we had to call and be like, do we come back in? And I was like, I don't think I can sit in another car. They were like, no, you'll be fine, you just need to put pressure on the site. So mum went out and got some gauze and some tape, and like taped it kind of tightly and pressing down on the things, and I had that for the remaining 48 hours that those were on. And I do think maybe that added to my discomfort, because there was now pressure on all of them for the whole time that the bandages were on, and so it made me feel like extra everything, I think. But it also made it very scary for me to have them taken off. Thank God I have a housemate, Leslie, who has an iron stomach. She used to be a dental nurse, and she removed the bandages for me. I will also say, the whole thing's oversharing, so sorry about that. They told me not to shave any of the surgical sites, so I just was having a full bush. I'm not normally a complete full bush girlie, and so full bush, and I was like, they've said they'll shave it. I don't feel great about that on a, you know, the idea of someone shaving my bush when I'm asleep, but we move. They didn't shave my bush, so my hair was just getting caught in the bandage that the nurse had to take off, which was so awkward, and then my housemate. So at least trim your bush would be my advice, because you don't want your long hair there, because it means that everyone that's taking the bandage off for you, or yourself if you're braver than me, will give you a bikini wax for free. So yeah, definitely trim at least. it says like don't shave because of infections. I'm just not touching anything, so I'm so scared of everything going wrong. So yeah, but that would be my like little tip there, would be at least trim her loads real low, because you just don't need that. It's so annoying. And yeah, in terms of recovery, I just took paracetamol every 4 hours, except obviously you can only take however many you can take in a day. I didn't go over it, but whatever the maximum amount you can take, I took every day for 7 days. I'd spoken to my pharmacist before, because obviously on the packet it says only take it for 3 days, and I'd already just had my period before that, which obviously is very heavy, that's why we're here, and very painful, that's why we're here. So I'd already been on it for 3 days, and before that I'd had a shoulder injury from the gym, so I'd also been on it for another 2 days, and I was like, can I just continue taking this drug? And his advice was it's the most safe painkiller there is, but obviously you don't want to overload it, because if you overload paracetamol, it's very dangerous for you. So anyway, I took that for 7 days, and then at day 7, I just felt like, even though I still was in pain, didn't want to overload my kidneys or my liver anymore from this whole experience, so I just stopped taking it. And that was super interesting, because I feel like, I don't know if anyone else experiences this, but paracetamol definitely like numbs my emotions a little bit, as well as the pain. So if I'm in sadness or anything in that nature, it kind of dulls it slightly. So on day 7, I woke up literally and just felt sad, decided I wasn't taking it, and then basically at the exact time where I would have woken up from my surgery a week before, I just was crying constant, like for like an hour, just like sobbing. It was also maybe the first time that my diaphragm felt and my abdomen felt like I could cry like that. Until then, like my abs and like whole abdominal area felt so sensitive. I couldn't laugh, I couldn't cry, I kind of was talking higher just because I was in so much pain. So I felt like it was the first time my body was able to like reach its range of like motion in terms of crying and breathing and laughing, which was wild. Yeah, even the first few days I couldn't have a glass of water filled up more than that, because it was too much to hold. No one had prepared me for that, and the whole thing's made me realize, like, women going through a C-section and then having to hold their baby is crazy to me. Like, I have three incision sites, they're keyhole size, and that was all I could hold for the first 5 days. Like, women who have a C-section have, like, you know, a cut like this length of your hand, and then have to hold a baby like that, but heavy. This is light. I could carry this, thank God. This has been my godsend. I bought an emotional support toy a few days before the surgery, and I've loved it. I've needed it. It's a jelly cat. I saw it in a shop a year ago, and I was like, at the time I was like, you don't need that toy. You want that toy, but you don't need that toy. And I was like, you know what? You need the toy. So I bought myself one. Highly, highly, highly recommend. And I kind of feel like it's like almost like a chic pillow. So anyway, I also bought myself this hoodie about a week ago. It's American vintage. It's expensive. But I was like, you know what? You've just been diagnosed with a chronic illness, so you deserve an expensive tracksuit. It's probably one of the most expensive jumpers I own. I didn't quite realise. I thought it had more money off than it did when I was there. That's okay. I deserve it. And it's the exact same colour as my eyes, so we're all good. But yeah, recovery was no joke. My mum stayed for 3 days. And then I've just had beautiful friends coming in and out since. And my friend Taylor she's been here. She arrived 2 days after my surgery, and she is still here. I kind of asked her to end up staying. She was staying for 2 nights with me in the beginning, because I kind of thought I'd need people till the Sunday. And then I actually asked if she could stay till last Wednesday, just because I still needed like loads of help with, like, you know, opening and closing my blinds because I couldn't reach yet, and like doing my washing because I felt like I wanted to wash my towel and my everything every day, because like you've got open wounds and I just felt weird about germs. And she's ended up staying for her own personal reasons for this past week on top of that. But I think it's been so great having someone here the whole time, because I'm also a person who spirals quite a lot, and I really think I needed that kind of support of just someone here with me that calms me down and helps me regulate when I can't by myself. So I'm really, really grateful that I've had someone, because I was so scared I was gonna have to do most of this alone and really rely on my housemates quite a lot, because I live in a share house, and that hasn't really been the case. But I feel like everyone's come together and really been a beautiful little village and support network for me. I had friends make me food. Eva, if you're watching this, I love you, you're an angel. And also my friend Emma, and that got me through the first few days. Like, first day I felt so nauseous. I didn't even know what my hunger cues were for like 5 days, but I knew if I didn't eat straight away, my blood pressure would be really low. So eat first thing would be my advice if you're in recovery. And eat loads of really high fiber food, drink loads of water, and take the stool softeners for the first few days. Please do it. And in terms of recovery, I just took things at my own pace. The leaflet is wild. That leaflet expects you to recover so much quicker, and so this whole time I've been comparing myself to that, being like, oh my god, is everything wrong? It told you to go out for a walk the next day. If I went out for a walk the next day, I would have had to be scraped off the pavement fully. Like, I don't think I went for I was, for the first 2 days, I think I just walked around my flat, like hunched over. I couldn't even stand up straight. And then I think on day 3, I went for a walk. I was like, I'm gonna walk to the beach. A walk that takes me normally 15 minutes maybe took me half an hour, saw the sea, and then got an Uber home. And I did that until like maybe day 5, would like walk to the sea or walk to a coffee shop and then Uber home. And then from about Wednesday, like after maybe 5 days or a week, I was able to walk to the sea and home, and walk to the beach and home, which was like a massive win, just noticing those things. And I also, in terms of recovery, made sure I sort of did one thing new every day, because I feel you feel so destabilized from how weak you feel that, like, you know, I couldn't even flush the toilet for the first few days because my flush is quite like hard, and it just couldn't, and I needed friends to help me get out of bed, like pull me up. So like when you get to that point of vulnerability, you need to kind of build things back up. And my housemate Leslie, again, is training to be an occupational therapist, so she's actually just finished. Congratulations, Leslie. But she was like, yeah, that's exactly what I would have told you to do. You need to kind of add a new thing that you do every day, just so that everything doesn't feel so big and you don't feel so small. And they don't tell you any of that in the recovery. They also said that your stitches would be out and like dissolved in 7 days. It's been 2 weeks and mine are still there. I have a big incision in my belly button. I don't think she'll ever be back. I think she's gone. I have an incision here, and I have an incision here in my bikini line. We'll see how they look. Right now the stitches are still very present, and I can still see my skin trying to come back together, so we're not healed yet. And I don't really feel comfortable going back to exercise really beyond walking until they're closed, because that just feels weird to me. It doesn't seem right. So yeah, those are probably the main bits of recovery. I'm sure there's way more that will come to me. I still feel like I'm in like a bit of a haze with it all. In terms of how the procedure actually went and like what happened on the day, so I've obviously videoed it all. I went in at got to the ward at like 7 in the morning. And I don't know if it's because I was there first or just first on the schedule, probably first on the schedule, because I think for the day, based on what I heard from the other patients later, not from them directly, but you know, you hear everything going on in the room, which is quite intense. I think mine was the most simple procedure of the day. So I went in at 7, was taken straight to like my bed for the day, which was very like cute. It was like you could see not the hospital bed itself, but like you could see out to the heath and like all the rolling hills, which was beautiful. It's right by the window, and it was a boiling day, and there's no aircon. Like the UK is crazy. How is a hospital doesn't have aircon to me? It's crazy, because that also probably means it doesn't have heating. I'm like, how is that safe? Anyway, I'm gonna keep rambling, and I'm sorry about that. But I was taken to my bed, told to put on my gown, They needed to do a last minute blood test because I'd had to have a blood test 2 days before to like check for antibodies in case I needed a blood transfusion or anything like that. And I don't think she took the right amount of blood or something, so they needed to do that again. And I was already so nervous, but I hadn't cried yet that morning because Mum and I got up and like I had a shower and we got on an Uber, and the Uber driver was just like actually a godsend of a man. He just like, obviously he knew I was driving us to the hospital, and he's a very chatty dude. So him and my mum were just chatting the whole time, and I was just watching the beautiful countryside like fly past in like my like, you know, what's that? I can't think of the word. My brain isn't working. Your side vision. And just like trying to like stay alive and not have a meltdown. But I think just like having the like blood test, just that tiny bit of pain just like sent me. So I had my like big pre-surgery cry, which I really, really needed. And I knew it would happen. I didn't know when it would happen. I've had surgery once before, and the last time it happened was on the operating table before they went in for my wisdom tooth and like put me out. So I knew it was gonna come. I didn't know when. Everyone was lovely, really understanding and beautiful. So many people came in and out to chat to me and do different things, different little tests, blood pressure, pulse, temperature, put these compression socks on. Then they told me there'd be a 40% chance I'd wake up without endometriosis and something chance that I'd wake up without the polyps in my womb that they would have passed in my period. And I don't know about you guys, but I've seen that they're about to offer a saliva test. So I was just like, for endometriosis. So I was just like, my God, am I going to go through all of this hectic level of invasion in your body and wake up without it? So that was a weird moment of being like, should I even do this? Maybe I don't have this disease. I really don't know if I do. Like, what a lot to go through. And they're like, do you still want to proceed? And I was like, well, I'm here now. I'm in the socks. I'm in the dress. Let's do it. So I agreed to do it. They then said goodbye to my mum. They wheeled me down at like 8:30 in the morning or 8:40 in the morning. Maybe I got wheeled down, and then you like get off your bed and you walk into a room with all the like anaesthetists and like their team. And then you hop yourself onto another bed, which I just was like, don't think about anything. It's a very different type of bed. And I don't know about you, but I kept seeing all these like horrible positions they put you in for the surgery, and I just didn't want to think about any of it. Like, I don't want to know those things personally. They put one cannula in, and again, that set me off and made me cry again, just because like, I just think I was so scared. Someone held my hand, and then I put the mask on myself and was holding the mask, and she was like, just chat, you don't need to count down. And the team was just so lovely, and I felt really held by them, and that's really what you need from that team, because it's, don't know if you've ever been put to sleep, but for me, I find it quite a scary experience. I don't like it. I don't like the idea that my body's there, but I'm asleep in that setting. It doesn't sit well in my mind. So they were all lovely, and you just know you're just gonna wake up, and then you wake up, but you can tell, like, it's not the same as, for me anyway, I don't know, it doesn't feel the same. It might just be a mental thing, like a story, but like, it doesn't feel the same as sleeping, because you wake up and you feel like time's passed, but you've not been there. I don't know, whereas sleeping, sometimes the sleep can feel like you just sort of blink and you open your eyes again. And I guess it's kind of like that for this, but it's also different, like, because your body's gone through something. So I woke up in the ward. She had to give me different types of drugs because I was in pain. They impacted me badly. The surgeon came in and told me I had endometriosis. He didn't want to tell me at the time, but I was like, did I? Please tell me. And he was like, should we have this chat later? And I was like, no, I want to have it now. And he was like, we'll have it again later, because obviously you're really drugged up. And then we had it again with my mum. And yeah, I felt like in hindsight it was a bit minimized, but he had a really lovely energy, showed me all the pictures of everything. I spent the day, in the ward probably. So I came out of surgery at 11:30 and I left the ward at 5 after a few pieces of jam on toast, which is funny because I probably won't eat jam on toast very often, if not ever again, because gluten-free and trying to be low to no sugar. And then we came back, and I don't know what we watched or what we did, but Mum was just present in the room with me, and I think I maybe ate crumpets because I just couldn't fathom anything else. I was like, gluten for the first couple of days because I don't know what else to eat when I feel this way, than like crumpets. And then Now that we're kind of through the first 2 weeks of recovery, is thinking about what's next, I guess. I'm in watch and wait. If I need more surgery, I go back to see the doctor in 6 months. So I guess we'll go from there. And then I've obviously done loads of research since, and I think I'm gonna pay for a private ultrasound to see more, because he obviously didn't go into any of the organs. He was like, I can't confirm if you've got anything inside your ovaries. And I'm also starting to realize maybe they didn't diagnose me with it, but maybe I have endometriosis because I have the thick womb lining. And it's not gone, I don't think, but I might not, I don't know. So I just feel like there's still so many questions, and I also feel like because they've left some on my bladder, I just really want to keep an eye on that. And they've not put me forward for an MRI. So I'm gonna have to pay for it myself. But like, yeah, if you look at the clinical evidence of how to care for people with endometriosis, like they should be having annual imaging done, both ultrasound and MRI, and they should remain in the care of a team, like for forever. It's a chronic illness. It's not something you should be discharged from. So that's going to require, I think, a lot of fierce advocacy from me to remain in their care, I think, and to remain in watch and wait with them. And yeah, I'm gonna have to invest quite a lot into my own, like, you know, profiling of this disease to make sure it doesn't spread to other parts of my body, or if it does, that we have, you know, the imaging of that and then can act accordingly. So yeah, I feel very emotional about all of it. I'm quite scared and quite, yeah, just like burnt out with the thought of like, that's something I live with now, and then it's, you know, going to require continued really fierce advocacy from me. And yeah, also trying to stay motivated to like do all the things that I already do that I hope help and I think help. But yeah, I think I also feel just a bit unmotivated and sad right now. But yeah, I'm just letting myself go through it all. And yeah, I guess my advice would be, if you have symptoms in your body that don't feel right, push to be seen, because you're not anxious or being a hypochondriac or really sensitive. You've got something that your body's trying to speak to you about, and it doesn't matter if it's this or something else. Like, your body's speaking to you, and you need to listen. And I know that's a scary thing to say, but I think we've been underplaying the relationship we have with ourselves and our interoception for quite a long time, and calling it anxiety and calling it, yeah, oversensitivity. And the more I understand my body, every time I've thought it was anxiety, there's actually something there, and a diagnosis. So yeah, if you take one thing from this video, please don't be scared of your surgery. If you're having one, you're going to be fine. I was so scared. Just make sure you've got your village around you. Make sure you've got an emotional support toy. Take 2 weeks off work if you can. You will need it. The first week for a physical, getting back to being able to hold more than half a glass of water, and the second week for being able to come to terms with everything that you've gone through. And then the other piece would be, go get checked out if you are watching this and trying to understand if you think you've got something like this. It's a long process for some people to get there, but you need to get yourself on that journey if you have really painful periods, or, you know, a combination of a sense that something is wrong. I think I'll speak more about like my symptoms and my like journey to this point in another video, and I'll speak about more about like how I'm gonna like manage it in another video. But thank you guys so much for watching, and sorry that this was a harder one to watch. And if you're going through something like this as well, I just want to send you all of my love. And if you're watching this and you know someone else going through something like this, please send them all of your love, because it's one of the hardest things I've gone through, for many reasons, and I think we need to support the people that go through this more than we do in society and in our communities. So yeah, thank you guys so much for watching, and don't forget to like and subscribe. Send me your love and your well wishes in the comments. Positive energy helps heal from near and far. And yeah, I'll see you guys in the next one.